Hey, my name is Shelby Nicholson. Today I'm going to be doing my catheter insertion video. Here's my ID. I'm going to do a room scan. So the first thing I'll do when I go into my patient's room is I'm going to check my order and my policy, and then I'll perform hand hygiene. I'm going to check my identifiers. So I have Jaguar J. Jones, date of birth 08/25/1963, date of birth 08/25/1963, allergies penicillin. So then I'll perform hand hygiene, raise my bed up to working height, lower my side rails. I would help position my patient in a dorsal recumbent, which is what I have simulated right here with their legs apart and knees bent. And then I would explain the procedure to my patient, provide privacy. I'm not going to be using a trash can today, but if I were, then I would position it and then don my goggles and then perform hand hygiene. So first I'm going to tell you the 3 indications of why you would need to insert a catheter. So required immobilization for surgery, trauma, or therapies, acute ventilator dependent respiratory failure, and palliative or end of life care. So next I'm gonna verbalize the perineal care. So for female, you're gonna want 3 swipes. 1 swipe top to bottom on the outer labial fold, then 1 swipe top to bottom on the near labial fold, and then 1 swipe down the middle. And then for male, you're gonna want 3 swipes too. The first 2 swipes you're gonna do around the gland's penis and in a circular motion, and then the 3rd swipe you're gonna want to clean all the way down to the scrotal sac. And now I'm going to provide my care. So I'm going to take my kit over here. I'm going to open it up. I'm going to take it out, and I'm going to create a trash bag with this. And I would put it next to my patient's hip. Okay, so I'm just gonna open outside and that, and then so now I'm gonna don my sterile gloves. Salt one grab. Okay, there we go. And I'm just gonna fix this. Okay. So now I'm gonna take my sterile field out. Let me fix this. So I'm gonna grab it by my 1-inch border. And then I'm gonna create a barrier for my sterile gloves. And my fingertip did touch the patient's leg, so that would be a break in sterility. And I'm just gonna kind of, okay, so I have no gap. Now I'm going to take my tray out. Okay, so I'm going to organize my supplies. I'm going to take my 3 swabs out. I'm going to ball that up, throw it in the trash. I'm going to take my jelly out, and I'm just going to squirt it into the compartment. And then I'm going to take this out. I'm going to take the cap off, throw it away, and I'm going to go ahead and attach it to my balloon. So now I'm going to go ahead and kind of adjust my tubing. I'm going to take the plastic off of this. I'm gonna ball that up, throw it away, and then I'm just gonna lay it in my lubricant. Okay, so I'm just gonna scoot everything closer to the perineal area. So, okay, I'm gonna lay that down. So now I'm gonna clean. So I'm gonna grab the labial folds, spread them apart. I'm gonna go outer, one swipe down, near, one swipe down, and then top to bottom, middle. Okay, so now I'm gonna get the patient to bear down as if they're voiding, take a deep breath, and then I'm just going to start. Let me just adjust this real quick. It's coming out. Okay, so I'm gonna slowly go in. I'll lubricate 1 to 2 inches for a female, lubricate 5 to 7 for a male, and I'm just gonna insert until I get urine. For a female, I would insert 1 to 2 more inches, and then for a male, I would go all the way to bifurcation. So after I insert more, now I'm going to hold it right there. And then I'm just going to blow my balloon up. Okay, I'm gonna hold pressure. I'm gonna remove this. And I'll discard of it, but I'm gonna be using it in a minute. And then I'm gonna gently tug, and it's still there. And then I'm gonna advance 1 to 2 more inches so that's not sitting on the bladder wall. So now I'm gonna get my stat lock. So my stat lock is very ripped because I was practicing earlier with it. But I would clean the thigh with an alcohol swab and then put it there. And then I'm gonna show you how to open and close it. So just zoom in. So there's closing it and then open. So I'm gonna put my bifurcation in there. And I'm gonna make sure there's not any tension with the catheter. I'm gonna close my stat lock. And then I would hang my drainage bag on the bed frame and make sure that there's no dependent loops in there. But for today, you know, it's not an adequate environment. So now I'm gonna get a towel. I'm just gonna show you how I get a specimen. Before I did that though, I'll clean up my area. I'll clean up all this and discard. I'll throw it in the trash can, but for now I'm just gonna sit it right here. So I would get my specimen container, and I would also throw away this trash bag as well. So I have my specimen container and a graduate cylinder. So I'm going to put it down on the ground. I'm gonna open my container up, and then to drain, to get a specimen collection, I'm gonna take this down. I'm gonna shift it so that it will open, and it's just gonna drain into my specimen cup. Any excess will drain into the graduated cylinder. After I'm done, I'm gonna close it. And so then I would connect it back up to this. I would close my cap, seal my cap, put my label on it, and then I would send it off. So I'll just so then to get it from the port, this is when my syringe goes back in. So to get it from the port, I'm just gonna heat the tube and clamp it. So I'm gonna get my syringe, I'm gonna put it in this blue port. And I'm just gonna aspirate however much I need. This will be opened up, and then I'm just gonna squirt it in there, put the seal back on, put my label back on, and then I would be done with that, and I would discard this. So that concludes the insertion. I would document. I'm gonna document the catheter size, the amount of urine, the type, the odor, color, how the patient handled the procedure, the specimen collection, and then I would teach them catheter care. So you're gonna use soap and water, and then you're gonna wanna remove the catheter as soon as medically indicated. So yeah, and then I would lower my I would lower my bed, raise 3 out of my 4 side rails. I would have my area cleaned up. And then after I collected my sample, I would unclamp the tubing. Okay, and so now I'm gonna show how to discontinue the catheter insertion. And then I would remove my gloves correctly, like so, and then throw those away. And so now for discontinuing catheter, you're gonna want to verify the order just as you would do any other time, and then you're gonna want to get some perform hand hygiene, get some clean gloves. I'm just gonna like reuse these as if they were clean gloves, just for the video's sake. So first you're gonna want to drain your bag. So you come down here, you get your towel, get your graduated cylinder again, take this out, and it would be lower obviously, but do the same thing. You're gonna open it up, let it all drain out to the graduated cylinder. That way you can measure the urine as well as drain your bag. Then after it's done, you just put it back. You're gonna document the amount and clean up down there. And so now in order to take the catheter out, you're going to get another syringe, okay? And you're just gonna tell your patient to just take a deep breath, and that you're gonna take the catheter out. So you're gonna get 0.5 milliliters of air in your syringe, and then put it in there, and just let gravity take its course and pull all of the water out of there. And for the video's sake, I'm just gonna kind of assist in speeding up that process. All right, so now you're just gonna take this out, discard of this, and then you would get a towel. I would have put a towel down before that. So, and then you're just gonna want to take it out, wrap it in your towel, and discard of all of this. And then you're gonna want, I'll throw that away, and then you're gonna want to perform perineal care on your patients after that, as I explained in the beginning, and then you're gonna document. So you're gonna document the amount of urine that was drained, how the patient tolerated the procedure, the color, type, amount of the urine, any secretions, and any abnormalities in the catheter to make sure that it was intact. And then you're gonna do your teaching on UTIs. So some symptoms of UTI is frequency of urination, urgency of urination, burning while urinating, and confusion. So after after I took my catheter out, I would come back to my patient and check in 4 to 6 hours afterwards, and if they had not voided, I would palpate their bladder or do a bladder scan. And yeah, I would remove my gloves, I would assist the patient to a comfortable position, lower my bed, raise my 3 out of my 4 side rails, leave the call light with them, and that is the end of my catheter insertion.